are moving into our first conversation for this morning as we discuss a skin condition that we actually see quite a bit in Belize. It's called vitiligo. And for those who perhaps have not used the proper name, it's where we have white colored or no color on certain parts of the skin. And here to explain it much better than I am at this point is Dr. Jorge Lopez, who is a dermatologist at Belize Medical Associates. Good morning.
Good morning, guys. Thank you for having me.
So let me allow you to do the definition and explanation as to what vitiligo is.
Okay. Vitiligo is a skin condition in which there is a blanching of the skin or some areas of the skin. No? The extent of the changes, it might be just an area or it might be all over your skin. Mm-hmm. That's basically what it is. No?
Yeah.
And it's not an inherited condition. It's even though there are some connections with relatives, but it's an acquired condition. That's how we call it. No?
Mm. Acquired.
Yeah, as opposed to inherited.
Okay.
So you
So
don't
it's
get it
not
from your
something-
parents.
There is a genetic component, but the thing is with vitiligo, it's pretty much the why and how. It's pretty much uncertain. We do have some theories, and the one that weighs the most at this moment is we see it as an autoimmune condition, meaning a condition in which the cells of your body are targeting the melanosomes, which are the cells that give us our complexion.
Yeah, the melanin.
Right? Yeah. But on the other hand, for example, we know that up to 30% of the patients that have vitiligo would have a relative that has the same condition. So we know that it's definitely a genetical condition, but multifactorial.
So we were talking during the break, and I think there are quite a number of white spot, I call them, issues that people have with their skin. People talk about liver spots, and there's several others. How do you differentiate what is vitiligo versus white spots that I may have on any part of my body?
Okay, that's a good question. Usually the diagnosis of vitiligo is pretty straightforward. We do it on a clinical basis.
Okay.
Rarely we have to take a biopsy, no?
Mm-hmm.
So we would go by the history, no? So somebody would tell us, okay, I have these white spots. Depending on the type, you have segmental, you have localized, so it's one spot. You have the generalized one that is usually symmetric, affecting the face, elbows, the dorsal of the hands, knees, right? It's usually in people like darker complexion, mm-hmm. You could spot it very easily, and it's milk white, mm-hmm. Right? That's very common. As opposed to other conditions like liver spots, it's not that
as white,
right?
Yeah.
And then what we do to aid in the diagnosis, because it's not always that clear, we have a special type of light. It's called Wood's lamp. So it's like a blue light, mm-hmm. And in that one, we recognize it very easily. But like I said, usually just by seeing it, we kind of make the diagnosis.
Is it something that somebody who has the condition should be concerned about, that it could have some detrimental effect on their overall health? Or is it just purely cosmetic?
Okay, we know that patients with vitiligo tend to have, number one, ocular abnormalities, like uveitis in the eyes, affection of the eyes, right? But sometimes, or most of the times, there are no symptoms. So we do know when we see a patient with vitiligo that we have to refer them to the eye specialist for them to check. Another important connection is that since vitiligo is an autoimmune condition, it is somewhat common for the patients with vitiligo to have also other autoimmune conditions. Yeah. One of them, or the one that is the most common, would be the thyroid condition, or autoimmune thyroid condition. No? Then you also have rheumatoid arthritis, for example, some cases of systemic lupus, you know. So those conditions could be connected. So you want to definitely screen, at least for thyroid. That's what we do as per protocol, no? Mm-hmm. And then, you know, depending on the history and what you see, then you would look further and see if there's any other autoimmune condition present.
You know, I've seen quite a few people in Belize with what I think is vitiligo.
Yeah.
How many people actually come into the clinic and come to see what it is and get it diagnosed?
I would say it's a condition that people tend to look into rather quick, because it's something that really affects you. It's like carrying around a banner saying, "I have a skin condition." You know, like you cannot really hide it when it's on exposed areas, and it really has a detrimental emotional impact on the patients.
Yeah.
And children, usually this condition presents between the peak of the condition presents between the age 10 and 30 years of age. About half of the patients would already have the condition by the age 20.
When you say the peak, what do you mean? Do you mean that it gets
The peak,
clearer and clearer?
no, the peak would
comes.
what I'm trying to say is the
Most
the
vulnerable.
most cases you see starting at those
Okay.
ages. It could happen at any age, right? It could happen at 25, it could happen at
I'm not
55.
25, so I like that. You point at me too. I'm not 25. Not 25. Not even close. But thanks.
So that's where people would most often present with symptoms.
Yeah, usually, right? But it could happen at any age.
So who's predisposed to developing vitiligo?
That's a very good question, but it's a really hard question to answer because, like I said, we don't really understand vitiligo that much. We do know that there are risk factors, for example. So when more than likely, if one has the genetic multifactorial predisposition, and then you toss in environmental factors or triggering factors, for example, pregnancy, trauma to the skin, you know, like a scrape or something. For some patients, contraceptives, taking contraceptives, right? Very common, especially in children. Emotional stress, then the condition could arise. No? So it's usually a mix of having the genetic component plus the triggering factors that are usually environmental. Yeah.
So I was going to ask that question in terms of environment. Is sun exposure, I don't know, dry skin?
Sunburn could also be another precipitating factor.
Okay.
Yeah.
Okay.
And you were saying that it's something that we're finding an increase of the incidences of this skin disorder in Belize?
Not really, you know, not to my knowledge. Obviously, we don't have any data to suggest.
But you would say that maybe one out of every how many? 200 persons in Belize would have?
Worldwide, the prevalence is estimated between 0.5 and 2%. Right? So that would put Belize probably like 300 people.
Yeah.
If we take into account 300,000 population,
I feel like
right?
I've seen more than 300 people, but
Yeah, there's a condition that resembles it in terms of the white spots, which is albinism. And that's a whole different story,
yeah,
right?
yeah.
Yeah.
So when someone gets diagnosed with vitiligo, you spoke of following up with a thyroid check to see if their thyroids are functioning properly.
Yeah.
But what do you do after that? Is it simply that they learn to cope with the discoloration of the skin that will progress?
Yeah. Usually when patients come in, now with Dr. Google, right? They have already looked into white spots and they probably came across the diagnosis of vitiligo. And then when you read about vitiligo, especially in the English literature, then it says it has no cure. So patients come in already expecting or dreading rather that, you know, we will tell them there's nothing to do about it. But truth is, there is treatment. And when my patients ask me if it has a cure, I always say yes. Because, I mean, it's a condition that we cannot really foresee what's going to happen. So nobody should be able or should have the right to say there is no cure for this. Plus, we see it in the office, right? I mean, most of the patients that we treat do get improved.
Cure as in reversible.
Yeah, the treatment, you could divide it into two types. One is to stop the disease, right? Say it's starting
Why?
on
Because
you.
it spreads.
Remember, we have different types, no? It could be one that is completely localized. You have only one spot and it stays there. But then you have the other one that is widespread, and then you have the other one that is generalized. So one of the treatments is first to try to stop the disease from progressing, and the other one is to try to reverse it, which happens, right? The earlier you come in, and the earlier you start treatment, we know that there are more chances for this to improve, no? And like I was telling you, in kids, at least in my personal experience, 99.9% of the cases, when I see a child and he or she has vitiligo, there are psychological issues there, abuse in the family, somebody died recently, divorce.
And it shows up on the skin.
Stress
like
trigger.
Yeah.
That's an amazing connection between the psychological, which is not biological, and the physical. That's weird.
Well, it's not really that weird, because when we are in the womb and we're starting to be formed, the ectoderm, which we call it, which is one of the layers, the brain and the skin come from the same one, right? And
It's kind of like blushing.
Or
Yes.
acne when you're stressed, or losing hair.
Amazing.
yeah, it's one of the triggers, definitely. But in kids, you see it. You also see it in adults, but in kids, there's almost always something.
Wow, I imagine that would be compounded by the fact that they then have, children, unfortunately, when they interact, can be brutal. And if you have a child that's just a little bit different,
Yes.
that would be reason for bullying, for teasing, for
Yeah,
a multitude of other things.
It's really sad, no? And one of the factors I have seen in kids is when parents are very demanding, like when there's a lot of pressure, spoken or unspoken, any of them, then children, obviously, again, no? It's not that every child will get vitiligo, but whenever you have the genetics.
From the cases you've seen.
Yeah.
Okay. What do you find that people fail to understand about this condition? What kind of misconceptions are you always having to correct when someone comes into the office, especially after they've consulted with Dr. Google?
Yeah. There are two things I would say. The first thing is it contagious, and or is my daughter, is my son going to have it? What we were saying, no? Is it actually inherited? Is something that I'm passing on to them? And secondly, if there's actually a cure, or it could be something done about it. Because like I said, when you read on the internet, most of the websites you looked into, it would be discouraging, no? So that's why I tell my patients, don't even bother, no? Let's do the treatment. And
So how do you treat?
Yeah.
there are different treatments, no? Depending on the extent of the condition. Sometimes you have to do pills. If the affection is localized or it's not too widespread, then you do topical medication, which we have available in Belize. There is actually in the States a medication that you apply on your skin and that dyes your skin. It turns it tan or brown. So in that way you cover the white patches. Obviously you have to be reapplying this like every 10 days.
Kind of like makeup.
Yeah, sort of. But something that stays for about 10 days, no? When the condition is extensive enough, and then the patient, his or her skin is white with brown spots, the most common practice is to simply bleach the whole skin, and that gives an appearance that is aesthetically more acceptable for the patient. No?
That's an interesting fact that we were discussing in the break. I know Kevin brought up that it was said that Michael Jackson had
that's what they
vitiligo.
say,
and when there was a lot of controversy about him bleaching his skin, what you're saying is that that's actually, once it becomes so widespread on your body, that's actually a form of how people treat how the disease may be treated.
I would say that's the norm when the patient decides it, no? And we usually take, if a patient has 50% or more of his or her skin affected, then that would be the choice, no? If the patient wants it, yeah.
Now, if I am, what parts of the body would it normally appear on?
It's usually, you have one of the forms that affects, for example, the mucosa, the lips, the tips of the fingers. You have the generalized one, which is the most common one, that affects around the eyes, elbows, dorsal of the hands, knees, and dorsal of the feet. That would be the most common one. There is one particular anatomic area that it tends to be quite common, and that's the genital area. And this is emotionally very devastating for patients as well, no?
Why would that be? What's different about the skin?
Not really. It's just that, it obviously evokes intimacy, so that puts you on the spot.
No, I don't mean
Why?
the embarrassment part. I mean, why in your genital area, or why in these specific areas that you're...
No reason
Blood flow?
whatsoever.
Yeah.
Blood flow?
No particular reason.
But most of these areas are areas where the epidermis is particularly thin, I would assume, because it's going over joints, because you said the tips of the fingers, the knees. I've seen it on the front part of the skin.
Yeah, but no, it's not really connected to the thickness of the skin, no.
It's just where the disease decides to,
Yeah.
or the cells tend to be attacked. That's so interesting.
Yeah.
Now, it also affects your hair as well, because when you see people with vitiligo, they also have white hair.
Yeah, that's called pyabaldism, and sometimes it happens. Yes.
Yeah.
But it's I would say it's more seen in the albinism as well.
Albinism.
No? Yeah.
As in there's no relation between the two?
No, albinism is completely inherited. It's recessive. So, in order for an albino person to be there, that means that father and mother had the genes, but recessive. So recessive means that if I have the gene, I don't manifest it.
You carry it.
Yes, I'm a carrier. No, so two carriers, then it would come into an
Person
albino
who actually
yeah.
has it. Yeah. Now, vitiligo has, I think, been a skin condition or disease that nobody really talks about so much, but now it is becoming, I think, a part of the whole movement we're seeing with self-acceptance, that people are, showing their skin instead of hiding it. And I think that's part of why globally people are talking about it. What do you find to be the barriers when people come in coping with their own condition? Are they struggling, or have they already reached a point of acceptance?
No, I would say the vast majority are still struggling, no? And always the fear is to be labeled, to be, actually segregated or discriminated in some way, no?
Well, why don't people take it as a light birthmark? Because especially if it's localized. I mean, that's what I thought it was. I thought, people have dark birthmarks, and I thought that some people had. I didn't know what it was. I thought it was just you either had a burn or you had a light birthmark.
Yeah.
So why don't people take the same approach to it as that?
In people with light skin complexion, it's actually very hard to spot. So there's usually no problem. But in skin like mine or yours, I guess what makes it difficult is the fact that if you have it,
Our skins are a little bit different, just a little.
Yeah,
bit.
a little bit. The fact that I'm staring at it, the fact that I'm gonna be asking, what do you have? Is it contagious? That I think makes it hard, because if you have it and nobody bothers, nobody asks you, nobody treats you different, then that would be okay. But I think it's around the people around you that makes it hard, no? Mm-hmm. Yeah.
How difficult is it and to treat, and what kind of expense are people looking at if they want to be able to stop or reverse?
Okay, there are some medications that are very, I would say, accessible. Some others are more expensive. And like I said, this condition tends to be something that we cannot foresee where it's going to go. But like I said, in our experience, usually at least we get to see improvement, no?
So how do you get the melanin producing cells to start working again? What's really happening?
Yeah, that's the idea, no? And that's why in areas where there is little hair, we know that it's gonna be tougher for the color to come back, like the tip of the fingers or the lips, because around at the base of the hair follicle, you have like a pool of melanocytes. So when repigmentation starts, it would be usually starting from around the hair follicle. So if there's no hair follicle, then that makes it more difficult.
Doc, we were talking about Dr. Google, and is there any risk that you could misdiagnose yourself?
Oh yeah, big time.
And think that you don't want to come in, you don't want to come into these medical associates. I'm going to save some money, and I'm going to probably purge or do something else. What are the dangers, and how would you advise people not to go to Dr. Google, as you call it, and come in to see a professional to find out exactly what it is? Can you make it worse?
Yeah, well, I think it could go both ways, no? It could go, and I've seen this, patients that come in because they have a mole and they think it's a melanoma, for example, which we don't mind at all because it's better to be safe than sorry. But the other option, it's more dangerous, where you read about something benign and actually what you have, it's something malignant, for example, and then you just don't look at it because you're confident on Dr. Google. So it's all, to me, in my opinion, it's always best to.
Dr. Google is cheaper though. I mean, not to follow.
Definitely.
Yeah, and I also think it's your own frame of mind too. If I want to believe something is wrong, I'll believe the worst diagnosis, and if I want to believe that it's nothing, I'll say, oh. Yeah, see, there you go. There's that one article that says it's not.
I agree. I agree.
You realize that, Manuel was asking about the cost of treatment, like how expensive could this be? And I don't think you got to that half of the question.
Yeah.
How expensive can this be? Is it very expensive?
It's going to break your pocket to be able to try to get back normal pigmentation?
Are you adding up numbers in your head? Because
I wouldn't think so. The thing is, like I said, I would have to factor in the amount of or the percentage of skin that is affected, the type of medication that needs to be used, because like in creams there are several. No, you would have some creams that cost maybe $30 a tube, but then if you have different areas,
it depends on how big.
And then if you're going to be using it for 1 month only, or if you're going to be using it for 6 months, all of that. But overall, I would say that the treatment is something that people on an average would be able to afford. No?
What are the risks for skin cancer? Because melanoma is also a part of your protection. Melanin, sorry.
Yeah.
Is also a part of your protection from UV rays. So does this mean that people with vitiligo are more prone to skin cancer?
That's a very interesting question. Theoretically, the areas with vitiligo, we could say yes in theory, although in the literature you don't find that connection saying, okay, patients with vitiligo have this percentage more of skin cancer.
Okay.
This is something you would definitely see more with albinism. In those patients, we know that yes, they definitely need to be more strict with sunscreen. Otherwise, the chances of having a skin cancer increase a lot.
Interesting.
Now, we missed the portion where we spoke of vulnerable populations, and we said that the peak time where people present with vitiligo, I think you said, is 10 to 30? around that
Yeah,
time.
that's where the majority of the cases would start. No?
What about gender differentiation, and also, what races are we talking about? Caucasians? Is it primarily dark-skinned people? Who's more prone?
Okay. In terms of the races, it affects any race or all the races, right? What happens is in people with skin phototype 1, which would be white people, it
doesn't show as
it's
much.
really not that noticeable, no? So any race could be affected. In terms of males or females, we believe that it's pretty much the same. Females and males, what happens is the females tend to go and look into this more often than males do. So that might give us the false idea that it's more prevalent in females, no? But not that we really know of.
You seem to have been very concerned, apart from the medical aspect of it, to the psychological aspect of it. What services are available after, okay, I'm giving you the topical cream. Do you then also prescribe counseling as well?
Oh, definitely. Well, what I do is I screen my patients with vitiligo for mostly depression. No, that's the one that usually would affect them. No, and when people talk about depression, the first thing that comes into mind is sadness and lack of energy. But truth is, I could be hostile. I could be snapping at you, and that's depression. Right? I wish Dr. Medina was here. But that's another
What is
thing.
a change in your disposition too?
Yeah. So you screen for it, and then
Depression there can be aggression.
Irritability.
yeah,
Irritability.
it could manifest like that.
Wow.
So, I think when we think of this becoming a global awareness campaign, which is what it is. World Vitiligo Day, I think, was the 25th of June. And a big part of it is exactly what you're talking about, because there's so many negative connotations and the psychological challenges that people have to overcome.
Yeah.
What would you say what do you say to your patients in being able to cope? And I know you definitely refer them to someone who can help them with their mental health, but their first encounter, and sometimes only encounter, might be with you. Yeah. So what do you say to them in trying to help them cope with this lifelong condition?
Well, yeah, that's a tough one, because we cannot pretend, to actually help a person in one session. No, when I'm gonna tell you, what, everything is fine. We're gonna treat this, and then when you come out, people are staring. So it's so what I focus on is on giving them the treatment and making sure that they have a positive attitude towards the treatment. Yeah. Right? Because it's an interesting thing. If you believe that you're going to get better, it's more likely that it will happen.
That's true.
So that's where I focus on.
Yeah.
Right?
Is it something that, okay, if I just leave alone, nothing will happen, and could the side effects from the treatment be more detrimental than just leaving it there?
Excellent question. That depends on the type, right? If it's only on one spot, like the segmental or focal type, it usually will just stop right there. You won't have any more. And this is also a very common misconception. If I have one white spot, so the fear is, when is it going to spread? And I'm really thankful that you brought it up, because like I said, it doesn't always happen that you will get it all over your body. You might have just on some areas, and that's where it stops, no?
Can you predict it, whether it's going to be the type of vitiligo that will spread or not?
If the patient comes in early enough, and we kind of start observing the condition, and it starts spreading, then you could have a saying there, no?
Yeah. So if I have one spot, I might say, okay, well, I've had one spot for 4 years, nothing's happened. I'm fine. But if I have one spot and then I start to see other areas coming out, that's the time to go to the doctor?
Well, the time would be the very first moment you see it, because
Okay.
like I said, the positive outcome is closely linked to how soon you start treatment.
Okay.
Right? But to go back to your question, nothing really happens if you leave it untreated. Actually, some patients choose to leave it untreated, and simply like what you were saying, no? They see, they like, you know, another skin condition, and they move on, no? Without any.
But it is important to get the other screenings, because if you have an autoimmune disorder,
Yeah.
it's good to know you don't have any other associated conditions.
Yeah, yeah. And then with the treatments we use, either, for example, topical steroids or calcineurin inhibitors, no side effects, not really. I wouldn't really be concerned about those. No.
And you can treat it when you're pregnant, I'm sure, and probably in other medical conditions as well.
You could treat it during
While pregnant?
pregnancy. Yeah, here the golden rule is in pregnancy
Don't treat
only
nothing.
what's
Yeah,
necessary,
don't treat
right?
nothing.
Yeah.
But
People don't even go to the dentist.
yeah, but if this is causing or giving a big burden psychologically, remember this is going to transfer to the baby as well. So then you have to walk that thin line,
Yeah.
right?
Yeah. All right. Well, this has been a very educational segment. And once again, can we just talk about how a person, or is it just best to go to the doctor? If I have a white spot that comes out, you know, how do I know if I should go get checked and find out if it's vitiligo? Are there any specific markers in the edges, the symmetry, to know that this is perhaps vitiligo versus anything else?
You know, sometimes even for us it's a little bit difficult. So I would say just go and check. That would be my advice. No, it's best to err on the safe side. Yeah.
Okay. All right, Doc. Well, thank you for coming in and
you.
educating us about vitiligo, and hopefully for people watching, they've also learned a bit more as well.
Yeah, hopefully.
We're going to go ahead and take a break, and when we come back, we'll be talking to the University of the West Indies about their upcoming summer program, so stay tuned.